thank you very much, everybody. And what I can say is it's an absolute privilege for us as an organisation to host such an event. And also it's amazing to see so many people in this room from far and wide across the country to attend this event. So it's really gratifying to see that there are so many people dedicated to improving the lives of patients with dementia. So I just thought at the beginning I would just set the scene a little bit. Obviously we've heard some really fabulous work from Professor Tadros and the work that's ongoing in HEFT and some of the work that he's supporting nationally. But actually let's understand really why we're here as a group of healthcare professionals and really understanding what the issue is across the whole of the NHS. So, and I'm sure I've got some of my figures maybe not quite right, but I will stand to be corrected. But actually in terms of that volume of people in the country around, that suffer with dementia, there's just under 1 million really people diagnosed with dementia in the UK during 2015. Although we believe that that's really probably only about 50% of the people that are actually have dementia. So we know that we underdiagnose patients with dementia. And that by the time we get to 2021, there will be over 1 million which have been diagnosed with dementia, but still actually we're not really hitting what the problem is. And the cost of dementia, we're talking about bed savings and impact on services. And I'll go on to talk a little bit more about that in a minute. But actually what we're seeing, the cost of dementia in the UK was over £26 billion. It's a massive, scary number, isn't it, that patients with dementia are costing, or we're having to plough those services into the NHS. And actually it's only going to get more and more. And I think what we need to think of in the NHS is how we do things differently and where innovation comes from to improve the lives of patients with dementia. We also know that family carers give 11.6 billion per year to caring for patients with dementia, and that's not cost that's incurred by the NHS. This is personal cost to families and carers, and when you start to add those two things together, they become even scarier numbers. And also on the worst case outcome, that what we are seeing is about 60,000 deaths each year directly attributed to dementia, but actually that's only for the patients that we know have dementia, so it probably is a greater number than that. And for those of you girls in the audience, really sorry to say that 2/3 of us will be diagnosed with dementia. And 1/3 of people over the age of 65 will also develop dementia. And if you think about the demographics of the country, and it's particularly pertinent for us here in Warwickshire, we're having an ageing population. People are staying well and fitter, older. We have additional services across health and well-being that support people to live longer. And the longer we live, obviously the more likely we are to have a diagnosis of dementia. And about 25% of NHS hospital beds are occupied with patients with dementia. And again, that is around those patients that are diagnosed with dementia. So it's probably an awful lot more than that. So the future for us, and this is pretty staggering really, and if you look at the light blue numbers in terms of our progression of numbers of people that will have a diagnosis of dementia, we're expecting that to double over the next 40 years. By the time we get to 2051, and I'm not sure whether I'll still be standing here talking to you all, but we'll be looking at almost 2 million. So I talked a little bit about the cost and where do we direct our costs around dementia. And so we've talked about that 11.6 in unpaid care, 4.3 billion in healthcare, 4.5 in state social care, individual social care budgets and all sorts of other services. And actually it's such a lot of money. Don't you think we can do better with that money than we currently do at the moment? And I suppose one of the questions I'm going to pose to you guys today are at thinking about when you leave here and on your long journeys back home is that can we do better? Can our services be better joined up? Can we use our resources in a much more cost-effective way? And where is the innovation? There's never, ever been a better time within the NHS where we were embracing innovation around doing things better, smarter, cheaper to the benefit of our patients. So there's a challenge for you there to go away with. But actually we've talked about the physical cost in pounds, but actually haven't even touched on what that emotional cost feels like. What that feels like to be a patient who is all of a sudden diagnosed with dementia. And that word is almost as bad as the C word, isn't it? Cancer. When you think about the devastation that often reaps on people when they have a diagnosis of dementia, I don't think we've even talked about the cost of that. But also there is the cost of the families and the carers that are then dealing with and coping with and managing on a day-to-day basis their loved ones through this diagnosis and also onwards as that disease progresses. And so we don't always think when we're talking about costs what that emotional costs are to ourselves, to our carers, to our families, but also to our patients. And we can all feel like this. And it's quite horrific for me as a director of nursing that thinks I can have some influence on nurse training in the curriculum, that actually nurses only get an hour's worth of training on average through their 3-year training around how to deal with patients with dementia. So no wonder our staff are confused, don't quite know how to deal with patients, actually don't do some of the right interventions at the first time early on in a patient's journey. But also this is absolutely how carers, families, but also patients will be feeling around their journey through this diagnosis. So a few more statistics for you. So by the time we all get to 80, how many of us are there in this room? There's quite a significant number of us. And if I go along and go 1, 2, 3, 4, 5, 6, whoever was sat in that chair would probably have dementia. 1, 2, 3, 4, 5, 6. Sorry. 1, 2, 3, 4, 5, 6. You can kind of see as we live older the impact that is really, really going to be having on us, and potentially all of us will be touched by that within our family or within our personal lives as we move forward. But I also think that one size doesn't fit all. We cannot put a service in that is this is the service and expect that to meet the needs of all of the patients that will access that service. We have to have flexible, innovative services that meet the needs not only of the patients but also of their families and their carers within hospital or community settings. So I just thought I would step back a little bit and say, why is this important to us as an organisation, and why we're so pleased to be here today, and why we're so pleased that you guys are here today. And a lot of that is down to Madeline, who you are going to hear from later on today. But Madeline, we have a process where we have a board story around a patient experience every month, our trust board, and we start the board with a patient story, so that when we are making decisions around where we spend our money or services that we make changes to, or services that we want to develop, we are doing that with the mindset that this is what it's like to be a patient in our organisation, putting the patient first. And so Madeline came to the board at the beginning of the year, where the board was developing our objectives for the year. And Madeline was so compelling in the story that she gave to board around the experience of a patient in the organisation with dementia, that we changed one of our objectives from what it currently was to having a primary objective for the organisation to create a multidisciplinary team around patients with dementia to improve their experience and their outcomes. So compelling was the story. So we have definitely Madeline to thank for that, and the patients of Warwickshire definitely have Madeline to thank for that. We're an integrated organisation, which means that we have both hospital and community services, and we cover the whole of Warwickshire at the moment. And so this does impact on us as an organisation, whether we're dealing with patients in the hospital setting or whether we are dealing with patients and their carers in the community. And so as an organisation, to make best use of our staff, our resources and our knowledge, we need to know what's the best pathway for patients that will flow in and out of our organisation without all of those horrible sticking points that when you admit somebody, when you discharge somebody, who do I talk to? We have our population in Warwickshire is rising rapidly, with lots of developments being built, housing developments, and so the influx of people within Warwickshire is growing, but actually with that we expect the number of patients with a diagnosis of dementia to increase as well. We have 10,000 dementia friends in Warwickshire, and I am proud to say that every single member of our board, the non-execs and the executive directors, are dementia friends. Our average age within our organisation is between 88 and 92, and therefore we have a high prevalence of dementia within our organisation. We do have a large, frail elderly population in Warwickshire, and it does create us significant challenges. But we've done some great work so far, and I'm sure Madeline will maybe be touching on that later on. But we've implemented a small suite of interventions based on clinical judgment and expertise that starts to make a difference to patients early on. So there are the things about making sure that, and I'm sure that you all do that, but we've got things where making sure that every single one of those patients is assessed, that they assess for their risks of falls, and that we expect every patient with that diagnosis of dementia to have this care bundle completed. And there's been significant work done in the ward areas to improve the environment to make that easier for patients with dementia to navigate the wards and reduce a number of those risks. We've been working on the model delivering excellence in dementia care, and we've done significant work along that. And I think what I'm trying to get to is that this is really an opportunity for us all to do something different. There is so much experience in this room, hundreds and hundreds of years worth of experience in this room, and you guys must have most of the answers to what we need to do. And so really we need a concerted effort moving forward to think about what that innovation is and take that forward and share. I don't mind stealing ideas from people. I think necessity is the mother of invention, and therefore if you've got a great idea over there, I think I'm going to borrow that. But today really is about sharing and celebrating innovation and best practice, and you networking really and sharing those ideas and getting contacts. So I'm just leave you with a little thought, is that, as I've said, there are only 4 kinds of people in the world. There are those who have been caregivers, there are those who are currently caregivers, and those who will be caregivers, and those who will need caregivers. And before I finish, I would like to say special thank you to Graham Stockton and Fiona Hassel from My Dementia Improvement Network for sponsoring this event. So thank you very much. We're all very, very grateful for that. And I also want to thank CETA for facilitating the event, and all of our wonderful speakers and all of you delegates for taking the time out of your really, really busy working days to be here. And also Professor Tadros for opening the event. Thank you.